Her name is Mindy Baker, and Mindy is not only a wonderful person with a beautiful soul, but she is a dear friend of mine. Many of you may or may not know, I was a board member for the George G. Glenner Alzheimer's Family Care Centers for 7 years. And over those 7 years, I learned so much about what this organization, Glenner Care, does for our community. A lot of people have never heard of Glenner. And although I have sent information out to our clients over the years about Glenner, I know that they are such an important resource for us. And I wanted to have 2 people in their organization who really hold that place up in the work that they do. So I'm going to just share a little bit about Mindy, and then we're going to spotlight her. So Mindy Baker is the Director of Education for the George G. Glenner Alzheimer's Family Care Center. She has 25 years. She doesn't even look like she's 25, but she has 25 years of gerontology experience in academic and applied setting with a focus on dementia. She bridges the gap between translating research, which is very important and confusing, but she simplifies it and puts it into practice. Being at Glenner is a perfect fit because she develops their curriculum and trains those who are on the front lines. So she has a Ph.D., which is amazing, in applied cognitive aging psychology and a certificate of gerontology. So all things brain health, Mindy knows. So Mindy, welcome and thank you so much. And I'm just going to say, Mindy is actually south of the border right now. She is in Mexico. And so we are all hoping that nothing happens to our technology. But I want to thank you, Mindy, so much for coming to us this morning. Share a little bit about yourself.
All right. Well, thank you so much, Linda, for inviting us to do this. We're honored and appreciate all that you've done for Glenner to advocate for us and make people aware of what we do. And more likely than having problems because I'm south of the border is just possible interruptions with a dog and a 3-year-old in the house. They are with others right now, but I apologize if you have interruptions. Yeah, a lot of years of experience because I started in high school working at a nursing home. I've always liked being around older adults, and most of my grandparents had, actually all of my grandparents had died by the time I was 4. And so I think to kind of fill that, I was kind of jealous of everyone. And so when I had a chance to be around older people, I welcomed that, and that kind of grew into working at a nursing home in high school. And then as I was working on my undergrad psych degree, I got a job as a caregiver for a woman who had dementia, and super sweet lady, but I had no training. They just said, hey, she's going to repeat herself a few times. And, you know, I just let her do it. So that was my training. And thankfully she was a pretty easy to get along with kind of person, but I observed that there's lots of things she could still do. She could still play piano. She was in an assisted living. She could still find her new apartment. She started recognizing that I was there to see her, even when we were, you know, I'd show up and she's in the lobby. I could teach her new card games if I simplified things. And then I had a cognitive psychology class that fall, and it all started to fit together. Like, okay, so this kind of memory, which we might, you know, things that you are trying to remember, like what was the name of that song, she couldn't do because that's impaired with Alzheimer's. And she could still play the piano because that was part of procedural memory, something that is a motor memory and that stays intact a lot longer in Alzheimer's. And so that's kind of was the start of my interest and desire to work with people, was just finding out there's a lot of research that had been done and a lot of things that people can do, but too often the focus was on you know, they have dementia, they can't do it. And so that's kind of how I got interested. And then with psychology, a lot of times it's hard to do much without a PhD, so I'd always kind of planned to do that. And as I started learning these things about abilities that remained intact, then that was really my focus. And so I was in this program that talked about normal aging, but then also what are areas that are disease related. And then I especially focused on dementia and things we could do, whether it be an environment or an activity, so that we could modify it and that we can kind of set somebody up for success rather than setting them up to fail, which often we unintentionally do, but nonetheless we do. So.
Well, I had shared with you just before the program that I wanted to recall a little experience I had with you, because I think most people, this is a huge fear for them. I mean, it's a fear for myself as well, even though in my family, we do have dementia related issues, but it's vascular and health related, which I don't know how you discern, but I was invited to do a dementia challenge with you. And my question to you after I share my experiences, is it normal to get dementia? Is that just something that we should all expect to get? So I am invited to do this dementia challenge, and I'm thinking, oh, this is going to be a breeze. And I'm not even going to explain what she put me through. But suffice it to say, I sobbed all the way home to my house in Ramona from Chula Vista, because one of the reasons I was crying is because I felt so horrible for the lack of compassion that I had for my clients' family members, who I had no clue what they might be experiencing. And I don't have dementia, but going through this particular test and being stressed in the way that you stressed me made me so upset and angry that I couldn't function the way I wanted to, that it just completely upset me. And it made me feel like, we really, really need to understand not only what people with dementia are going through, but also understand the caregivers. And I know that's what you guys focus on a lot. But so my question is, I thought after I did that, I'm going to be in big trouble, because I think I got dementia right now, because I failed many categories of the test. Is it normal to get dementia? Are we all going to get it?
It is not normal. And let me see here if I can advance my slide. Maybe. Oftentimes people think, well, if you live long enough, you will end up with dementia. But dementia is not part of normal aging. And, oftentimes we hear stories of in the news about, people who've turned 100 or people who are doing amazing things, triathlons or different things. And of course, that's, rare, but it is absolutely possible to continue to be healthy as we age. And so just to kind of give you an idea, and Alzheimer's is one type of dementia. So here on the slide, you're looking at a normal brain and beside it, an Alzheimer's brain. And you can see that the Alzheimer's brain has a lot more space in between the convolutions there.
Maybe
and
I don't think we can't see the screen. Can you share it? Can you guys see it? Not yet. Hold on a sec.
Sorry about that.
That's okay.
Okay, here's our share screen.
There we go.
There we go. And then,
yay, success.
And
Brain stress.
there we go. Okay, now can you see it?
Yes.
All right.
You.
And now as I'm trying to look at it, I'm looking at our faces. Okay, so you've got a normal brain and an Alzheimer's brain, and you can see there's a lot more spaces in the Alzheimer's brain. And that is showing you how much the brain shrinks because the neurons are being destroyed. And so when you see symptoms with somebody, if you can, have an image of how much less of brain power, literally, they're working with, it's a lot more, I think, understandable. And at the bottom here, this is like a slice of the brain taken through the center. And you can see that there's the center part are called ventricles. Those get larger. They're full of cerebral spinal fluid. And as those get bigger, it kills cells that are around it. And then you also see, different areas here. There's all that white is a big hole, whereas you don't see that on the other side. And those are areas related to developing memories. And so they don't have all of the brain cells that we have. And so I always include this, even though we're talking about normal brain health, normal. So what is not normal is dementia. And dementia is a diagnosis of a group of symptoms. And it includes memory impairment, which most people think of that. It's usually short-term memory impairment. It could be long-term or other types of memory. It also includes one other area of cognition that's impaired. So that could be perception, it could be attention, it could be language, it could be reasoning or problem solving. And so, for example, you might have somebody who has Alzheimer's and they are having trouble remembering things that just happened. I have no idea if I ate lunch today, let alone what it was. You add to that, I'm also having a lot of trouble coming up with names of things. And I have a hard time focusing my attention. So those might be some initial symptoms somebody with Alzheimer's would have. Whereas you could have somebody else who's had a stroke and they have memory impairment where they're actually having some problems with some of their long-term memory because the area of the stroke affected that area of the brain for long-term memories. And then they may have a lot of problems with language, like not being able to put together a full sentence anymore because the language center of their brain was impacted. The other.
Can I just ask you a quick question about that? So how do you discern the difference between what's normal forgetfulness and what is these types of things you're talking about? I know are things that people really fear, but don't we all have normal things that, like, our brain function isn't always just tippity top, right? We do experience memory issues that are normal, correct?
Correct. So that's actually, I think, the next slide. So just for dementia, it has to be memory impairment, another area of cognition that's impaired. It has to be so severe that it does not interfere with everyday functioning.
Okay.
So we may have some, tip of the tongue, I can't come up with it. Where did I put my keys? But it's not going to impair my ability to do my job. And then the other part of the diagnosis is that the symptoms have lasted for at least 6 months or more. So that's dementia, and there are lots of different things that can cause it. And then real quick here, young brain, older brain, you see some changes, but not a lot. This shows some area that's being activated when people are asked to do things. It's not activated so much with the older brain. You see ventricles are a little bit larger. Young brain is smaller, but not a lot of change. And so here's I think a helpful slide that shows, okay, so what's mild forgetfulness? What is normal versus a serious memory problem?
Mindy, can I ask you one quick question? I'm sorry, I keep jumping in, but I had a thought about the slide before where you had highlighted the brain where a younger brain, somebody is asked to do something and that spot is lit up. Would that portend then as we age, we should be engaging in activities with our brain that cause it to have to work? Is that what this is implying?
Yes, absolutely.
Okay. So our brain should not retire even if we retire?
No. In fact, that's one of the biggest, I think, problems is that a lot of times people don't have a plan after they retire, and they don't have a purpose as much. They don't feel that they do. They're not working towards something. They're not being actively engaged in reading or learning new things. And so when you have that drop off where people are just sitting around and doing a lot of nothing or watching TV, that's really detrimental for our brain.
Okay, thank you.
Mm-hmm. And so here's a quick example of normal aging versus Alzheimer's. So reasoning is one of the things that can be affected specifically with Alzheimer's. And so, once in a while we all make a bad decision, right? But somebody with Alzheimer's is having really poor judgment and making bad decisions a lot of the times. Maybe they are out of control buying on a spending spree and buying things that they don't need, wouldn't normally buy, and you see something odd coming up with that. They might, we get busy, we miss a payment. But somebody with Alzheimer's is all of a sudden, it's really hard to manage monthly bills. And so maybe you find a whole bunch of unopened mail that they've not even seen the bills. Or maybe they tried and they just can't figure out the steps to take to do what they need to do to pay those bills anymore. And it's become a major problem. Forgetting, as we get older, we do tend to forget a little bit more, especially names of people. It's more difficult to access that information in our brain. But you usually, if you forget something, you can come up with it later versus, forgetting something and not remembering it later, not even remembering that you forgot it in the first place, losing total track of the date, the time of year. So not only, it's not that you don't remember today's date, but maybe you're thinking, gosh, it's still, it's summer when it's actually winter, because you just have no sense of time and can't keep up with everything. As I mentioned, sometimes forgetting which word to use, but and that is an initial symptom, but that turns into I'm not able to actually have a conversation with somebody anymore because there's so many words I can't come up with. I can't get my thought into a complete sentence to be able to explain that to somebody.
Mindy, I think one of the reasons why we want to get our clients resources, especially on this type of thing, is because what we experience a lot sometimes is family members, when they call us and they are inquiring about the long-term care insurance benefits of their parents, and they're frustrated and sometimes angry with their parents because they're making poor decisions or they're not doing things that maybe the family thinks that they should be doing. And I don't want to use the word angry, that might be too strong. I think fear probably is at the root of a lot of the response from some of the family members. And one of the things that I'm recognizing is that people don't see that these types of issues it's a bigger problem. It's not, that your mom is just deciding she doesn't want to take care of things anymore, or that she's forgotten her great grandchild's birthday again. It's nothing personal. And it's for us to be able to turn people to a resource to say, hey, these are the things that we're experiencing, and the way we're responding to mom is making it worse. Because these types of things present themselves a lot of times before a diagnosis comes, correct?
Yes, definitely. And so as you were sharing about the dementia challenge experience and how you felt during that, which I felt bad that I made you feel bad, but the fact that it made you more aware, then I felt like, okay, I guess I did do my job. Because oftentimes we don't put ourselves in the shoes of the person with dementia. I think a lot of times it's a lot easier to relate to a caregiver. And so in the same way, before a person's even diagnosed, if it's your mom or your dad especially, it's hard to sometimes think of them as not your mom and your dad, but just as a person. And so, think for yourself, if you were all of a sudden having a hard time managing life, would you want to admit that to your kids?
No, I mean, in fact,
Right.
Part of the struggle with doing that dementia challenge was trying to not be a perfectionist, but these are things of my own failings in my own life. I wanted to hide the fact that I couldn't literally get through that. And I wanted to hide I didn't even want to answer the questions because I felt really bad that I didn't know the right answer. And I like you, and I want to always present my good self to people. And that was one of the things that I thought about, is why some of our clients start isolating. Because even though they're maybe not able to connect, oh, I have dementia and this is why I'm isolating. I think that safety issue with all of us is so huge, like innate, that I just want to hide. I just want to pull back and let me just go hide in a corner over here.
Yeah. And if somebody's drawing attention to your failures,
yeah,
then you're gonna want to avoid them too. Like, well, gosh, Mom, why won't you answer the phone when I call? I'm checking on you. I'm trying to take care of you. Yeah. And she may be thinking, I don't want her to see that I can't remember stuff anymore, and I don't want her to see. So it's easier to approach the parent or spouse or whomever if you can kind of separate yourself from the relationship that you have with them and think about how they might be feeling as a person and how you would want to be treated. So having lots of compassion and patience rather than, oh, come on, Mom, you know better than this. Like, what were you thinking? Which is oftentimes our natural reaction to things. We have expectations of our loved ones and that they do the things they've always done. And when they can't do them, it's frustrating to us. But instead to kind of back up and let them know it's okay. Things are safe. I'm here for you. We're going to figure out whatever it is. And, again, think for yourself. If someone approaches you that way, then you're going to be a lot more likely, I think, to say, okay, I'm having trouble with something.
So, I'm wondering if the people that are watching this webinar are in their mind saying, okay, can you just tell me how to avoid this? What do I need to do not to let this happen to me? Is that a reasonable question?
Yeah.
Tell me.
Tell you. So, kind of the bad news is that there are lots of people who are suffering from impairments, and whether that's dementia or maybe it's something that could be potentially reversed if we take some action, or possibly prevented if we take some action. I apologize, I was looking for my statistics there. Okay, so according to the American Heart Association, 3 out of 5 Americans will develop brain disease in their lifetime.
Oof.
And by 2030, the total cost of Alzheimer's and dementia and stroke is expected to exceed $1 trillion. So yes, we need to pay attention to brain health. But the good news is that aging well, it does depend on a lot of things. It depends on genetics, so that's the one thing we can't do a lot about. But it also depends on our lifestyle choices and our environment. And so, even if we generally feel healthy, as we mentioned, there will be some changes in memory and learning. It might become more difficult to multitask, might be more difficult to find some words, and paying attention can be a little bit harder. But even as you're older, you can still improve your skills, learn new things, absolutely, create new memories. And oftentimes, vocabulary, there's a lot of abilities that are actually better as we age, like vocabulary, some creative problem solving based on years and years of experience. So it's not all negative as we get older. There's a lot of positives there too. If I had more time, I would tell you all of those. But to more specifically answer your question, what can we do? And these last 2 slides are from, there's a whole PowerPoint that has been created by Health and Human Services. And I'll share, I have a link that I can share with everyone because I think it would be helpful if you really want to know more detail. I want to go into each of these more in depth. It would be a great resource. So what we eat really, really impacts our health. And none of us usually want to hear that because the things that we usually like to eat are not the things that are best for us, like sugar. But there have been lots of studies that show, changing our diet, having more of like the Mediterranean diet, things like that are really making an impact for our health and body, as well as our mind and brain. Regular exercise makes a huge difference, especially aerobic exercise, because we want the blood to be flowing in our brain. And if we're not doing anything and we're not improving, cardiovascular system, then we are more likely to have stroke. We're more likely to see vascular dementia. Keeping our brain active, that can be, anything from just learning something new, learning a language, doing some online games. The idea is to just, have new and interesting things that you're encountering, because when you learn new things, you're making more and more connections between the brain cells. Along with that, social connections. So, you get the benefit when you have a social connection of generally you're talking to somebody, so you're engaging your mind as well. The social interaction affects our mood and our feelings, which also relates to things like, depression. Depression affects memory. So all these things are really connected. And so being able to have a social network and group, which I know is a little bit more challenging these days, but it's really important. And sleep is also really important, because when we sleep, the brain heals itself, and it kind of cleans out the toxins and the junk that's in there. And if we aren't getting enough sleep, then that stuff starts to accumulate, and in a most simplified explanation, it gets in the way of the messages that need to be sent, and the system doesn't work so well. So, we could talk an hour on all of those different things, but it's really kind of the combination of all of those different components to take care of yourself and help your brain be healthy.
So Mindy, your segment is coming to a close, but I just want to ask really quick an obvious question related to the social connecting. And I don't know, Lisa might be highlighting this as well, but the whole issue of COVID and what we have going on now, my gosh,
Yeah.
People aren't getting out, people aren't able to connect. Is it possible that this, even though it seems like a really long period of time in context of our whole lives, it's a short period of time that we're having to do this? For people who have dementia, just give a quick 3-minute answer on how you think this is impacting and what families can do.
So I think I'll give a quick example that might help demonstrate the benefits of connection. So I had was working with a caregiver. She was part of a caregiver class. We're going to talk about those here. And her mom started coming to our center, and she had vascular dementia. And she, just within coming twice a week for a couple weeks, family started noticing a difference. She used to not really initiate conversation at all. She didn't want to go do things so much. And they noticed that she started talking more, just in general. And then she started initiating conversations. And then she started doing things that she hadn't done for a while, like helping create sushi rolls for New Year's Eve. And so really the only thing that had changed, her daughter said, was her coming to the center. And so by coming to the center, she was getting social interaction she didn't have before. She was doing dementia-specific activities, so things that she could actually do, that they were appropriate level of difficulty for her. And so that's someone with dementia, but the same kind of thing happens with just, as we get older, and any of us, if we are able to be around others, and now with COVID not being able to be around people physically as much, but doing things like this webinar where at least you could see somebody's face and have a conversation with them, the importance of that. I know I'm an introvert, and even for me, it's starting to get to be a bit much to not go to work on a regular basis and see people in the office, just going out to dinner with people, those things that we were taking for granted and now are, we're not able to do as much. And so taking time to find ways to interact, we have to be a little more creative, but.
Wow. I mean, I highly recommend, of course, anybody, if you need information about brain health, resources, and Lisa is going to talk a little bit more about this in a few moments. But Mindy, I just thank you so much. And I know that we're going to stay connected because we are connected and we love helping people in this way as well. So thank you so much for taking time and joining our webinar this morning. And so now we're going to meet Lisa Tyberski. And Lisa Tyberski is the Chief Marketing Officer at the George G. Glenner Alzheimer's Family Center. And Lisa has an amazing background in the insurance industry, which is interesting because back in the day when I first started selling long-term care insurance, I worked a lot with Unum, and that's who Lisa worked for. And we didn't even know back then that our paths would be crossing again. But I mean, there's people in our industry that have a heart for serving the elderly population in unique ways. And I'm so thankful that you're at Glenner. So Lisa came to Glenner, I think I was maybe on the board for a year, the board of directors for a year, and our CEO hired you. Best decision he ever made. But I just want to thank you also for coming. And I think you also have a profound story if you'd like to share that before you share the information about the Glenner Centers.
Sure. Well, yeah, thank you, Linda, for that nice introduction. And yeah, it was a small world. When I first met you in the boardroom, I remember you were like, oh, nice to meet you. And then when I said I used to work for Unum, what? Oh my gosh. Yeah. So that was such a small world. But yeah, so I used to work for an insurance company, different than working for the Glenner. But what brought me to the Glenner is my mom had Alzheimer's. She got it in her 60s and passed away at age 71. And we were kind of, Linda, like you had said in the beginning of this, after doing the dementia challenge, kind of clueless. And I wish I had known the things that I know now back then, because we really didn't understand what was going on with her. Also my aunt, so her sister had it, and she was diagnosed at age 55 and died at 65. So the two sisters had it, they overlapped actually when they had it. So it was really devastating, and none of us, me and my cousins, we just didn't understand the disease at all. So about 2 years after she passed away, I thought, you know what, I need to work in this space somehow. I don't know what, maybe I'll volunteer. I thought about volunteering for the Alzheimer's Association. I thought, I don't know, I just said, I've got to do something in this space to help other families that are going through what we did. And then it was just a strange happenstance that I met this woman that knew our former CEO, and one thing led to the next, and then I got hired. So I do the outreach and marketing at the Glenner Centers. Mindy, of course, as she said, does the education. And my role is just to share with the community what we do, what our services are, and kind of help connect people how to get involved with our services. So that's my background story. Again, I have such a passion for it because I just remember being clueless back then. And I know many families are, because if you haven't gone through it, why would you know? How would you know that? You know, you hope you never have to know that. Frustration, Mindy, that you were alluding to, that a lot of caregivers get is so common. And there's a quote that I've learned since I was hired here. It said, the dementia patient is not giving you a hard time, they're having a hard time. And that always resonated with me. And even when I share it on social media, it just blows up, because it's like, wow, that's exactly what's happening. Caregivers get so mad and frustrated at their behavior, but they don't understand. Can you imagine being them? Mm-hmm. I look back, I'm like, gosh, can I imagine being my mom? You know, when we would say things like, Mom, you said that, or don't you remember? And that's like the worst thing to ever say to somebody with dementia. So anyway, so that's what brought me to the Glenner Centers. I love it. It's a wonderful organization to work with. Everybody has such a heart for this population. And so just if we're ready, I can get into some of the other services that we do.
I would love for you to share what Glenner does. I mean, it's an amazing organization. I don't know, were you going to share a little bit about the background and
Yes.
how the Glenner came to be? Okay, go ahead.
Yeah, this story is profound. It can be a little bit upsetting, but we tell the story just so that the community understands we know what we're doing, and then also that people understand why we were founded. So Dr. George Glenner was a physician and researcher at UCSD. So he was doing Alzheimer's research. But in the middle of the night one night, he and his wife he and his wife, Joy Glenner, who is still alive. Unfortunately, Dr. Glenner has passed away. They received a phone call late at night from the husband of one of Dr. Glenner's Alzheimer's patients. And he was distraught. He was at the end of his rope. He had a loaded gun, and he told Dr. Glenner, he said, I can't do it anymore. And he was going to murder his wife and commit suicide. So again, I tell that story because it's so profound in sharing how distraught caregivers get. Of course, he loved his wife and he didn't want to do such a horrible thing, but he literally had nowhere to turn. He had no resources, and he just couldn't do it anymore. And this was in 1982. And back then there weren't dozens of home care agencies and beautiful assisted livings and daycare centers. So when that happened, the next day they were able to halt that murder-suicide, but the next day they thought, gosh, we've got to do something. Research is so important, but we've got to do something for these people now and these families that are suffering now. So they ended up opening a small daycare center in Hillcrest. That one it's not operational now due to COVID. That's another story, but that is, it's still in existence. And it was our very first center, only licensed for 24 people. And then they expanded, and now we have a center in Chula Vista and Encinitas as well.
One of the things that was so interesting to me when I came on the board, naively, I thought, well, the adult day centers, their focus, of course, is on the patient, the person suffering with dementia. And in fact, I quickly found out that the Glenner really, the main purpose is to support the caregiver.
Yeah, it's really both.
The difference between the two?
Well, they kind of go hand in hand, right? So we help the person with dementia by providing a safe space for them to go during the day. They go and participate, in dementia-friendly activities with a staff that understands the disease, not like I was when I was caring for my mom. They go to the day center, have an enjoyable day, and are safe and supervised, where the caregiver then gets a break, because a lot of times, people, they think they can do it on their own. They try to do it on their own. They're getting upset. They're getting frustrated. They don't understand the disease. They can't go to their grandchildren's soccer games. They can't go out to lunch with their friends. They can't even go to a doctor's appointment because they have to watch their parent or spouse with dementia. So their loved one with dementia is at our center. The caregiver is getting a break. And sometimes that's all they need. They don't necessarily need their loved one to go into a residential community yet. It might happen down the line, but in the beginning, not usually. They want to keep them living at home. They're okay nights and weekends, but they just need a break. And so that's what we do. And that gives the person time. It gives them respite to go off and do what they need to do. They come back, they picked up their loved one, they're rested, they're regrouped, they feel like they can handle it then. But the 24/7 caregiving really, really, really wears on people.
So aside from adult day services at the 3 centers, and I think you're going to share a little bit about the unique characteristics of each center, you guys also offer support groups and different types of things for the families as well, correct?
Right. So our 3 main service lines are, of course, the specialized adult day centers, which you're right, they each have their own little personality. And I especially want to highlight our newest and most innovative one in Chula Vista in a minute. But we do have caregiver support groups, and those are huge. They're very, very popular. They're vital for caregivers. And while the caregiver is in the support group, we'll offer free respite care for their loved one with dementia. Because a lot of times people say, well, that's great. I'd love to go to a support group, but I can't leave my husband alone or my wife alone. So we will provide free support, free respite care while they're in the support group. So in addition to the caregiver support groups in that space, we also offer free caregiver classes that are funded by a grant. This will be our 2nd year doing them. Mindy runs them. They're funded by the Arthur Root Foundation, and they've provided funds so that we can do an 8-week caregiver class. We do free respite associated with that, but also an 8-week caregiver caregiver class. And if we want to open it up for questions later, Mindy can talk more about the details of that program, but that's huge. It was very, very successful last year. So we got the grant another time. So it's both for the person with dementia and the caregiver. We serve both, and that's really, really our niche and our specialty. And then our third main line of service, we do volunteer programs. We have another program called Memory Cafes, where people go, it's more of a casual environment. People go and do trivia and brain games and things like that. Those are suspended now due to COVID. But the third main line that we're still very, very active in is, it's called Glenner Care. And it's a virtual dementia care program that we just launched, several months ago we launched it, but we've been working on it for about a year. And it's weirdly ironic how needed it is now, having no idea, of course, anything like COVID or all this stuff would be happening this year. We started working on it last year. And basically what it is, it's exactly, that's a virtual dementia care program. So you're at home, you can't get your spouse to get in the shower or to eat, or they're trying to leave, and you don't know what to do. You don't want to go to the doctor or the emergency room or urgent care, and you really have no tools and no skills to really know what to do. And a lot of those scenarios can be solved if you had an expert team behind you that you could just call. So you can call hotlines. There's lots of great hotlines out there, but this is different. Ours is actually a program where you enroll. You would call you have a social worker, a nurse, a care liaison that's actually in your team, or becomes sort of your care team. You call them up and you say, my husband will not get in the shower. He's had an accident. I don't know what do I do? And so that team then can advise you over the phone. They can get on a video call or just a phone call, email, text, whatever needs to happen. But then that avoids an unnecessary trip to the hospital, urgent care, and the doctor's office, especially now during COVID, which is worrying for a lot of people. So that's really our third line. So it's the daycare centers, the caregiver support groups and classes, and then the Glenner Care program.
Lisa, I don't know if I'm asking this question right. How severe does a person have to be in order for Glenner Care to make sense for them? Can a person have MCI, mild cognitive impairment, and still benefit from something like Glenner Care?
Yeah, it's really the caregiver that's benefiting, because it's teaching them how to deal with their loved one that has dementia. So it's really anybody that needs assistance.
Okay.
If someone has MCI and they feel that they don't really need this program and they've got it, great. If they need assistance, they really don't know what to do, they can enroll. And then all the way up to more severe, or I shouldn't say severe, but I should say advanced dementia. It really depends. If it's not 911, it's not an emergency type of service at all. It's really an ongoing caregiving, like, support system is what it is. So there's really no stage of Alzheimer's that's appropriate. It's really just based on the behaviors that you're experiencing at home, that you don't know what to do with and you need help.
What if our clients have family members out of the state of California? Is Glenner Care, can they access this service even if they don't live here?
Yep, 100%. So that's what's great about Glenner Care. It's anywhere because it's virtual. It's all phone, email, text, and video call. So the daycare centers, of course, are specific to San Diego because you are physically driving there. But and same with the support groups. Actually, now we're doing them online, so people can join in from all over the place. But Glenner Care, yes, they can join in from anywhere.
And then what is the cost of joining Glenner Care?
Glenner Care is $95 a month, and you're not enrolled. I mean, you're not like 6 months. You don't have to enroll for a year or 6 months. It's month to month, and you could just try it. You know, it's private pay. It's all private pay right now, and
well, we're happy to say we did a test case with one of our clients with Glenner Care, and their long-term care insurance is paying for it. So
yeah.
I'm shocked. So happy about that.
Well, and it's private pay, right? And then long-term care reimburses him. Yes.
Right. It never hurts to ask, but
Yep.
it's, I was really impressed with the amount of documentation that your staff provided for us to be able to get that service approved for our client. You had said something about the unique characteristics of the Glenner, And I would love for you to share a little bit about Town Square. I wish we
Yeah,
had
so
a video to show people, although people may have seen Town Square on the news. But anyway, go ahead.
yeah, so I'll
For
just
just a second.
Yes, Mindy.
I just wanted to share too with Glenner Care, one of the, and this goes for our adult day centers too, one of the key components is that not only does our staff have expertise in dementia, but they take the time to get to know each participant, each client individually, so that, especially with Glenner Care, when you're calling in, it's not just that they know what generally works, they have a history of this person and what their interests are, and so they can individualize the advice that they're giving, which is something you wouldn't get with just a 1-800 call. There's that relationship and familiarity with the person, which I think is amazing. Our staff's amazing at that.
Yeah, that's a great point, because if they try a trick to get somebody, or tip to get somebody in the shower one day and it didn't work, you're calling the same team and they say, well, that didn't work. And they say, okay, well, let's try this. So that is a really good differentiator between a hotline and what we do. So back to the day center. So I had, we'll get to Town Square in a second, but I did want to describe, Hillcrest was the first one. That is near and dear to our heart. It's in a little blue house in the heart of Hillcrest. That's the first one from 1982. Some people like that environment because it's small and it's home-like, and that's actually why Dr. Glenner and Joy picked that as a house. They didn't want people to feel like they were going into a hospital or a nursing home. The Encinitas Center is inside of a Silverado senior living building. That's a completely different setup, but that relationship works well. We rent space inside there. But what do I want to call it? The Mac Daddy, somebody referred to our Town Square Center as the Mac Daddy of daycares, because it is, it's very unique. We've been open for about two years. It's inside of a big warehouse building in Chula Vista, and we've built out the inside of the warehouse building to resemble a small 1950s town. So we gutted it. It used to be a lumber company, wholesale lumber company. We gutted it, and we built these individual storefronts, which are really just rooms, activity rooms. We call them storefronts. But the whole idea with the space is to facilitate reminiscing, because I think Mindy had mentioned about short-term memory and long-term memory. Short-term memory usually goes first with people with dementia. Long-term memory is often left intact, but you just need to know how to pull it out. So everything inside of Town Square, and that's the nickname, or the name that we call this particular Glenner Center location in Chula Vista. We call it Town Square. But so everything inside is designed to facilitate reminiscing. Reminiscence therapy, music therapy, pet therapy, art therapy, they're all very, very therapeutic with people with dementia. But reminiscence therapy just means we are bringing people back to where their memories are the strongest. So if you're living in a world and someone is asking you questions about what's happening now, or they're forgetting, like Mindy had said, what they had for lunch, if they ate lunch and what they had for lunch, but they can remember songs from high school in their early 20s. They can remember movies and things from their youth. And so if you bring that out in them, they're having a conversation about something they're resonating with. Can you imagine how confusing it is to have a conversation with someone and they're talking about stuff you have no idea? But when you're talking to them and they're resonating with something from their past, it brings joy and purpose and happiness to kind of an otherwise very, very difficult situation. So that's what we've done in Town Square. We have a 1950s diner. We have a pub with a pool table. We have kind of a park area where people will do chair yoga. We have the Humane Society come in with, not now because of COVID, but normally we do, and they'll bring pets in. A big movie theater where we'll show old movies. So it's very, very, very unique. We've also franchised this across the country, and it's still going well. We had a couple maybe drop out because of COVID, but it's still going well. It's slowed down, of course, but it's going well. So we franchised it, and we're opening up Town Squares across the country. So we're really, really excited about that. That's sort of the new next generation model for the Glenner Center.
So yes, it is the Mac Daddy. It's even for people that just want to go down, really can't do it now because of COVID, but I've taken people down there to tour it because it's so fun just to go in and look at it. You do really feel you definitely do not feel like you're in an adult day. One of the things that I'm curious about is, I mean, it's wonderful. I love going down there, but do you guys see a therapeutic benefit with reminiscence therapy and this model and the correlation to how your participants are after they go home? And does it help them with those disturbances and whatnot that their families are dealing with?
So I can speak a little bit about it, and then Mindy is very knowledgeable about this part too. But what I've heard from other families is that they go home, they sometimes maybe don't remember specifically the activities that they did, but they know that they had a good time, they had fun, they leave tired, like a good tired, instead of being home watching TV all day. So they sleep better at night, which then of course creates you being in a better mood from getting more sleep. So it's sort of a rippling effect. So they go home, again, tired and having peace of mind and having had a good day. As far as some of the benefits, Mindy does a lot of studies on that, and maybe you can add a couple things in there, Mindy, about that.
Yeah, so just to build on the story I was telling you earlier about the woman who enrolled and she started to see her mom really engaging. She was part of our first group grant that funded the caregiver education program, and it's now been a year, and she came back in to share her testimony of her experience. And she said that although her mom hasn't been in our day program since COVID, she just really wants to keep her home right now, that she is still doing better now than when she first enrolled. So basically she was in our program from August to March and improved significantly. And then not being enrolled even for a few months after that, she is still being able to have benefits from that program, as well as the daughter said, some tools that she learned through our program that she's able to use now that she's home all the time with her mom, having ideas of how to do some activities with her and different things. So there's a one-on-one example. There is definitely a lot of research on the benefits of reminiscing, and with that program we were able to collect some data on those that were enrolled. It's a small group that we have data on, about 17 people. But for all of them, they improved. They had benefits. They're not going to no longer have dementia, but they're able to, go home and sleep better. They're oftentimes more interactive. And as Lisa said, they may not recall exactly what they did, but you'd be surprised how many people actually remember the center. So even just for them to know that, oh, I'm going to Town Square, and if they know what that is, that's huge that they can remember that. And they often remember that because they have positive emotions associated with it. So they're able to go and, like Lisa said, talk about something that they know about. They know about their past and they love talking about it.
Yeah, in fact, I'll just share one quick story, and then I want to get to some of these questions because our time is running short. But I don't know if this is anecdotally. When we were down there at the Glenner Center, part of one of the storefronts is Town Square, an actual town hall that looks like the
City Hall, yeah.
City Hall, thank you. And there was a lady whose son brought her down, and I believe she was an accountant. That was her job. And the son was just so distressed and stressed out about leaving her. And through a series of her looking at the different storefronts and going into City Hall, she saw the typewriter, which was a typewriter from, I believe, the 50s, a desk that was older. Just the whole vibe took her back to her work. And in fact, she started working. Am I correct? Is this a correct story? They had a space for her. They had her papers there that she would come, and her son took her to work every day. And it was such a powerful example to me of that reminiscing and how that tapping into the brain just brings such joy, because we are created for purpose, right? And the whole thing about Town Square that I love so much is bringing people into that purpose of why they exist, we exist, and it's to have purpose in life and to create and to be part of something. And that town square does that so beautifully. So I have a couple questions here, you guys, and the first one is, to attend the support group, does a patient have to have a dementia diagnosis?
Well, support groups are for the caregivers, and all of the conversation is geared towards caregivers that are caring for someone with dementia. So that will be the subject matter at the support groups.
So what if
you
somebody,
don't have to have a diagnosis? You could be caring for someone with a memory
okay,
challenge and go to the support group. You also don't have to have a loved one enrolled at one of our daycare centers to come to the support group.
okay.
And the person wouldn't have to have a diagnosis to get the free respite care either, right?
Okay.
Yeah, I don't think, no, they don't have to have a diagnosis, I don't think.
One of the other questions is, and I don't know if you all at the Glenner, if you guys have webinars that you offer to the community, because this is a great question, and the question is related to more information, doing a little bit of a deeper dive on prevention and treatment. That is a great question. I don't know if you have webinars or you have information that people can join that they can learn about prevention, or if we need to do another webinar to talk about prevention and treatment. What are your thoughts on that?
Mindy,
We
do you
do
guys
have-
do that in the Root Grant classes, prevention?
We don't actually. We don't talk about prevention. It's kind of, these are people who are already caring for their loved one. And so the focus really is on giving them tools to help care for their loved one. We do a symposia twice a year, which generally is more for professionals. And so certainly we could do one on prevention, but it's not something that we've done yet.
What about, because of COVID right now, is it safe for someone to come and bring their loved one to the centers? And what are you guys doing to protect the participants?
So I can answer that one. So yes, I mean, we believe it's very safe. We've started many new safety protocols. We have contactless pickup and drop off, meaning the caregivers don't even come into the lobby. They drop their loved one off and pick them up. We will walk them outside. We take the temperatures of everybody. We ask a series of health questions to everybody when they come in. The cleaning is nonstop. All the activities, and it's been a challenge for our staff, but that's why I kind of said at the beginning of this how great our team is. They have all risen to the occasion. Taking care of people with dementia in the middle of a pandemic and trying to explain these things is not easy, but they do it. And so they keep the participants 6 feet apart. They've got those TV tray tables, and so they'll be doing a group activity, but they have everybody at an individual table. Everyone does have to wear a mask. And we provide for free, we'll provide masks for all of our participants, and they're designed to be a little bit, they have an extra space here, so it doesn't feel so confining against their mouth. So they're a little bit more pointy. So we've had those specially made for all the people that come in. So we're doing all of that. And if anybody has any symptoms whatsoever, they need to, go home for a symptom hold. So yes, so we believe they're extremely safe. And the benefits of coming to the center and experience and participating in the activities and the socialization is just, it's so important. We're seeing people that have chosen not to come back because they're afraid deteriorate at a rapid rate at home. So yes, they will be safe.
Well, I have one more question. Let's see. Going. 2 more minutes. I think the thing that I would like to add before we wrap this up is as it relates to our clients and their long-term care insurance, just really, really quick, about this whole issue with dementia, memory problems. And again, and I say this all the time to our clients, is regardless of whether or not you think that you're going to file a claim or you should file a claim, we want our clients to reach out to us to ask us those questions, because as it relates to long-term care insurance and getting a claim approved, with a cognitive diagnosis is a very specific process. It takes proof, and that proof has to be very specific and directed. And so we just really want our clients to make sure that they reach out to us if they have any questions about that. In particular, we want our clients to have access to your community, which is one of the best gems in San Diego for people who are caring for loved ones with dementia. And Lisa and Mindy, I just thank you so much for joining us. I miss seeing you guys.
I know, all these screens.
Yeah, and I was thinking, oh, I'm gonna come down for Thanksgiving dinner at one of the centers, and that's not happening, is it?
No,
Yeah.
it's not happening. No, but yeah, I want to just kind of piggyback on that, Linda, is that, you know, reaching out for professional help, which a lot in this caregiving space, a lot of people look at that as a failure, but it's really not. It's a gift. I mean, knowledge is power, right? If you're a struggling caregiver and you're nothing but frustrated 24/7, taking Mindy's classes or you know, talking to our team and learning how to take care of someone with dementia, it's a gift.
Yeah.
And giving your spouse with dementia an opportunity to go to a center where it's, we don't even like to call it a daycare, to be honest. We call it a senior center. And oh, it just so happens everybody there understands dementia, but it's a place to go have fun. That's really how we look at it. And it's really a gift that you're giving yourself as a caregiver and a gift to your loved one. So that's the way we look at it. And we try to bring, you know, bring joy to people's lives in an otherwise really pretty difficult situation.
Well, you do that. And you guys make my life joyful and happy. And I'm looking forward to when this COVID thing is over, coming down and seeing y'all again. But to our clients that jumped on and took the time, took an hour out of your morning to join us, I just want to thank you so, so much. This just means the world to us. And again, if you need these resources that we have, just send us an email. We'll be happy to send them over to you and connect you with the people that you need to be connected with. And with that, we wish you all just a safe and blessed Thanksgiving with whoever you're going to be spending it with, and looking forward to 2021, starting afresh and anew with new possibilities and caring more for one another. So you guys, thank you so much, and all my best.
And if anyone has questions and wants to stay on, I'm available afterwards. I just saw a question about Dementia Challenge. So after you've officially ended, I can still answer questions for folks.
Go for it, Mindy.
So Dementia Challenge, we created it as a class to really help people understand empathy for the person with dementia. And so we haven't done it since the pandemic. Hopefully we'll start up again in March. And you go to different stations that simulate the cognitive changes associated with dementia. So one that Linda was probably one of the most frustrating ones for her, because it is for everyone, is while you have sensory impairments with cotton in your ears and up your nose and yellow glasses on, then we also start asking you questions like how many inches are in 4 feet, and add that to the colors of the rainbow. And we are really taxing your long-term memory, even though that's often usually intact, but also working memory, which is trying to manage and manipulate information while you're holding on to it, and then adding to it and subtracting to it, which is very, very difficult, especially for somebody with dementia. And then you add music to that, and you're overloading attention capacity, and so you're getting that sense of what it feels like to have dementia. So that's just one, but there's 6 different stations that you go to. After that, we discuss and talk about all the different areas of cognition that are impacted, not just memory. And then most importantly, what do you do? Knowing that those areas of cognition are impacted, how do you modify it? So for example, one thing would be keep things quiet, eliminate distractions. So yeah, if anyone has any other questions, I'd be happy to answer them.
I just have a comment about that. Now I know why loud music in restaurants drives me crazy.
Mm-hmm.
Because it, just like when I was doing the Dementia Challenge, when the music was playing, I was just like, turn that music off. I can't think. And so when we go into a restaurant, my husband and I are always like, can you turn the music down, please? And our kids are always a little embarrassed about it, but just like, I just need to focus on what's at hand right now.
Yeah, it's just too much. And then usually places have TVs, and now some of them have games at the table, and it's too much.
Like
All
going
right.
into Corvette Diner. You know when you go into Corvette Diner? And
Yes.
it's like, oh my gosh, I have to get out of there in like 15 minutes because it's so noisy and so much stuff, you know? And can you imagine if you had dementia?
No, no.
And then people get all annoyed and then they blame it on the dementia, but actually if you just took them to a quieter place, it probably would go better.
Mhm.
You know?
Yeah.
For sure.
Okay, you guys, no more questions.
Thank you so much for having us, Linda. We really
Yeah.
appreciate it and
you.
appreciate you.
Yeah, God bless.